Hi guys, this is Dr. Kuchi and I'm here to talk about a very highly contagious bacterial skin infection. Any guesses? That's Impetigo. What is Impetigo? Impetigo, as I said, is a highly contagious bacterial skin infection that affects infants and young children, but it may also occur in adults. Causes and risk factors. There are two bacteria which cause Impetigo. Number one is Streptococcus pyogenes, and number two is Staphylococcus aureus bacteria. Risk factors, there are multiple factors involved in Impetigo. Number one, poor hygiene. Number two, warm weather. Number three, crowded living conditions. Number four, skin-to-skin contact with an infected person. Number five, insect bites or skin injuries. Signs and symptoms of Impetigo. Signs and symptoms of Impetigo typically appears within 1 to 3 days of exposure and includes number one, red sores and blister on the face, especially around your nose and mouth. Number two, formation of yellow or golden crust around the sores. Number three, itching and burning sensation. And number four, swollen lymph nodes. And number five, fever or mild fever, but in some cases. Types of Impetigo. There are two types of Impetigo. Number one is Non-Bullous Impetigo, which is characterized by red sores and formation of yellow or goldenish crust around the sores. It's a very common type of Impetigo. And number two is Bullous Impetigo, which is a very severe or less common type of Impetigo, and it's characterized by the formation of blister or large blister. Treatment of Impetigo. Treatment typically involves topical antibiotics in the form of cream or ointment. Number two, oral antibiotics. Number three, keeping the affected area clean and covered. Number four, avoid scratching to prevent the spreading of the Impetigo. Prevention of Impetigo. Number one, practice good hygiene, frequent hand washing. Number two, avoid close contact with an infected person. Number three, keep the skin injuries clean and covered. And number four, avoid sharing personal items. Complications of Impetigo. Untreated Impetigo can lead to cellulitis, which is a deeper skin infection, and number two, kidney damage. Post-Streptococcus in bacteria may cause or may damage the kidneys.